Good afternoon. I'm Professor Andrew Chilton and I'm the Medical Director at Kettering General Hospital Foundation Trust. We've had a fantastic response to the COVID vaccine. However, the response hasn't been uniform, and we know that some communities the uptake has been less than in other areas. So today I'm joined by a number of friends and colleagues, all who've had the vaccine, who are going to talk to you about their experience and why you should have the vaccination done. Thank you. I'm delighted to be joined by Dr. Raja Reddy. Raja, tell us a little bit about your professional and personal background.
I am originally from a southern part of India. I came here after my graduation back in 1995 and then did my exams here and eventually became a consultant in respiratory medicine in 2007. So that was about 14 years ago, and since then I've been in Kettering working in the respiratory department, both with my team and now leading my team.
Thank you, Raja. Raja, it's probably an underestimate when I say that you and your team have really led the front line on this. You've really seen the impact of this new condition, this very profound mnemonic condition that we've got from COVID. Can you tell us a bit what it's been like? Because the aerosol generation procedures, the different treatments, the no treatments, treatments developing, and then vaccination.
Yes, looking back at any disease, from the discovery to the treatments and what goes on in between, usually used to be quite a long period of time. But with this, it has hit us straight away. It has hit us hard in terms of the mortality. And also we have seen, or experienced the progress in science. So much so, we've gone from a very new disease to almost the prevention with the vaccines in a very, very short period of time. So really, you lived a life's journey within the last 1 year, to be precise. And it's been quite a journey, with the mortality being as high as it was, touching 35% in terms of the patients who have been admitted to the hospital. It's been a traumatizing experience as well, But at the same time, it's very heartening to see how people, especially the health community, responded to it. My team members and everybody within the hospital and in the wider NHS, how they reacted to it, how they all together managed to bring us to the position we are in now. So we really reached this far through the untiring efforts of all the healthcare community and the scientists, and eventually have something which will make a big difference in terms of controlling this disease.
Raja, I think I'm going to take this opportunity just to thank you and your teams for the excellent, sort of exhausting work that you just provided day in and day out during this. We've got a preventative therapy now in the form of a vaccine. However, we know that the uptake has been different in different groups, and some of the BAME groups have had a poor uptake. Why do you think that may be?
Mainly, through the misinformation being spread through the social media, which seems to catch like wildfire, really. And if you listen to different groups have different concerns. One says, oh, it's halal, not halal, or another group says it will affect my fertility, and if you go to Another bunch of people from a different community, they say something else, maybe something like, oh, it'll alter my genes, or somebody externally can then control you. So all sorts of misinformation is being spread, which has really no scientific basis to it.
So Raja, on the subject of myths, a lot of people, as you say, have been worried that their genes might be affected by this. Do you want to give them a message?
Yes, looking at it scientifically, as we all have to do, there is no way the vaccines can alter your genes in any shape or form. Of course, the mRNA vaccines are new, but they don't really alter your genes as such. They themselves will get into the cell and get the cell to produce the proteins which are necessary for the antibodies to be produced. But however you look at it, they really don't change your genes or your personal genes, so there's no way of putting it, but the best way to explain it would be, they have absolutely no effect on your own genes.
Okay, well that's really a very positive message. What message would you like to give everyone out there?
So all I would say is, as I said, it's been a lifetime's journey in 1 year, and really we're nearly at a stage where we can make a big difference to how we cope with this disease. And now is not the time to fall prey to the rumors and all the misinformation being spread. So I would say, please do get vaccinated, as it's going to be life-changing. Maybe not for you, but for the whole community. It has been a life-changing experience, how we had to pull together to cope with this illness. And now is not the time to let down our guard. So I would say, please do get the vaccination done for the sake of everybody, either yourself, your family, and for the entire country and the humanity in general. So దయచేసి అందరూ వ్యాక్సిన్ తీసుకొని మీ కొరకు, మీ ఫ్యామిలీ కొరకు, సమస్త ప్రజల కోసం మీరు వ్యాక్సిన్ తీసుకొని అందరినీ సురక్షితంగా ఉంచేందుకు ప్రయత్నించమని మనవి చేస్తున్నాం.
Thank you so much, Raja. Thank you so much. I hope you found that informative and helpful. I was joined by multiple colleagues from multiple different backgrounds, all of whom have had the vaccination and all of whom are really making the case for you to go ahead and be vaccinated if you haven't been. This is the way we're going to fight the condition. It is the way we're going to get our liberties and freedoms back. We've really been confined for a long time, and our lives have been turned upside down. This is part and parcel of our way out of this, and as you saw, most people were able to address the many myths that are associated with the vaccination. And I would urge each and every one of you to go out there, if you haven't been vaccinated, and get the vaccine done. Many thanks.